strategies examine the context in which individualised care is assessed, planned and delivered, along with any associated triggers. There are steps that everyone can take when delivering care across a range of NHS settings. Prevention relies on meeting personalised care needs where the patient is an equal partner and working together with the healthcare professional to design appropriate care. This collaborative approach requires positive staff attitudes, compassion and empathy. As challenging behaviours can occur without warning, staff need to be aware of, recognise, identify and anticipate what can often be very subtle changes in behaviour. Translating the reasons for challenging behaviour into unmet needs through use of patient profile will help to identify strategies to design care accordingly. To do this, good communication is a key principle.
Morning, Joe.
Oh, good morning.
I'm coming to give you a freshen up just before breakfast. Is that all right?
Right. Is it Jenny?
It's Kerry.
Kerry.
I'll help you
Kerry.
with your glasses,
Right.
okay?
Oh, thank you.
Just get you some nice warm water, all right, Joe?
Oh, right.
How did you sleep?
Oh, all right.
Yeah?
Thought I
Nice
had
quiet night?
What?
Nice quiet night, was it?
Thought I heard a dog barking.
No, not in the hospital. Did you want a flannel for your face?
Oh, right.
Yeah?
Did you say Carol, was it?
No, it's Kerry.
Kerry.
Yeah.
Kerry. Sorry, Kerry.
Did you want to have a go?
Oh,
There we go.
right.
What did you fancy for breakfast this morning?
Well, I wouldn't mind some toast.
Some toast. Did you have tea? Cup of tea?
Yes, tea would be nice.
Yeah.
Excuse me, Joe. Kerry, can I have a quick word with you, please?
Sorry, Joe. Won't be a minute.
We've rescheduled the meeting from 1 to 2. Is that all right with you?
Yeah, that's fine.
Okay, brilliant.
Thank you.
Who was that?
Sorry about that, Joe.
Was that-
Joe is 75 and suffers from dementia. He's becoming anxious and agitated.
I've got to take George and Philip
It's
off.
fine. Is George your son?
Of course he's my son.
Yeah, George.
I've got to get back.
Is he the
We've got to
accountant?
get...
There is always a cause of clinically related challenging behaviour, even if it's not evident at the time.
Point is,
Joe.
there's him and Philip. I've got to get them off
It's
now.
okay.
Otherwise...
They came to see you yesterday. They're coming again
Who?
today. George and Philip. They're coming to see you again today. Your
Come to see
son.
me?
It is vital that staff build a profile by reading a patient's notes and by talking to the patient, relatives and carers to help understand the reasons for a patient's distress and identify solutions. In addition to this, observing, identifying and documenting potential triggers are part of a proactive strategy for minimising stressful or distressing situations.
I think he's got children. Grandchildren? Have you got grandchildren?
Yes.
Yeah. So we'll have a nice wash and then I'll come in and see you later.
Anne, are they coming too?
I'm not sure. I'm not sure about today. We'll find out when they get here, yeah? That's
Yes.
it. Here's the towel, my love.
Thank you. Oh,
You'll pop these glasses back on and then I'll go get you a nice cup of tea, shall I?
oh yes, please.
Okay, let me
Is
get
George
rid
here
of
now?
this. Not now, very shortly I think he's coming.
Right.
We'll find out, all right?
Right, thank you.
Challenging behaviour results from a combination of factors. You've got people who are prone to it, they're very vulnerable, and you've got situations that provoke or escalate the difficulties. So, for example, people with dementia often won't know where they are or aren't able to understand why they're in the hospital. And they may misinterpret the actions of staff or what's going on around them. In hospital, necessarily, you've got a lot of movement. It's busy. There's lots of faces, lots of questions. And people with dementia can find this overwhelming and overstimulating.
I think that for many individuals with a learning disability, hospital can be a frightening experience, and certainly the available evidence tells us that they commonly experience fear, disorientation, anxiety. And if you think about a clinic, it can be a very busy area. People are coming and going. There's a lot going on. And for somebody with a learning disability, and like a lot of people with cognitive impairment, it can be difficult to understand or make sense of what's happening. But there are things that we can do to make the experience safer better for someone with a learning disability.
When you're trying to design a care plan for a patient, it's important to know that every individual is different. There's no template or stereotype because their medical needs are going to be different, their background, their biography, their personalities are going to be different. Who's important to them is going to vary one from another, and the way people react to situations is going to be very different. So you have to understand all these things. You have to know what somebody's disabilities are, what they can't do, but you also need to know what they can do. Just because somebody has, for instance, dementia, doesn't mean they can't do anything. They often have what we call retained abilities, and we have to use those and make use of them. So it might be that they can feed themselves or help with dressing. It might be that they can engage in some much more complex activity, like games or making their own breakfast.
A good way to minimise challenging behaviour is again recognising that everyone's individual and everyone has different levels of need. The most important way is the therapeutic relationship that you can build with the patient. This might be using something like the "This is me, we have a about me." This is discussing various different things. This actually pinpoints what do you do when you're angry, how will we know when you're angry, and how do you react in certain situations. Knowing someone's occupation or previous occupation, if bringing up a topic of their interest might be a way to de-escalate a situation. Another way is the environment. How can you make the environment so that it's more friendly? The physical environment can create a great impact on how we deal with challenging behaviour. We have various different colour orientation boards that help with being orientated. We have a day room, which can be actually quite a good distraction technique because we offer activities there to make it a bit more homely, to distract them, because people can get bored in hospitals, and sometimes if you're in pain, that's what you ruminate on, and that can cause distress in itself. A calm, positive environment where staff attitudes always being positive, where they can be, which can have a great impact on challenging behaviour and how that's dealt with.
Communication is really important, informing people and letting them know. And when the patient is here, having a carer with them who can communicate and help them to understand what is happening and what is going on is also really beneficial. Ideally, if we can prepare people before they come into clinic, so that's where the carers have an important role. So if they can help the person to understand what is going to happen when they come into clinic, that they might be waiting, and then what will happen when they go into the clinic room, that's all very helpful.
Involving patients in decision making is absolutely crucial, both from a clinical perspective and a legal perspective. We always have to take into account patients' wishes and respect their autonomy. And if even to touch a patient, you either have to have their consent or it has to be in their best interests. To find out about their best interests, there's nothing you can do other than ask them. So we are legally bound to involve patients in decision making and to try and ascertain their wishes. Now that can be difficult if somebody's very communication impaired, if they have difficulty thinking and reasoning. You may have to adjust what you do, but again the law tells us that we've got to help them as best we can. So for example, if a patient doesn't speak English, we have to find someone who can translate for them. If they're deaf, we have to make sure their hearing aid's working. And if they have a communication disorder, we have to adapt our language to try and help them have the best chance of being engaged. Now that doesn't mean to say that you do everything that a very confused patient says you should do. But you have to take it into account. But the very act of engaging them helps the relationship. It's showing respect, it's providing activity, it usually helps. Hospital wards are incredibly busy places, and it can be very difficult to find time to do these things. But doctors and nurses and therapists, day by day, are doing a lot of routine interaction with patients, and there's a saying in dementia care that every task is an activity. So if you're washing a patient, or if you're helping them to eat, these are times when interaction can occur. Complex health problems usually need a variety of health professionals to help deal with them, multidisciplinary working. And you'll find that doctors and nurses and occupational therapists, physiotherapists, speech and language therapists all contribute to the bigger picture. Now this is going to vary very much from setting to setting, but certainly when you're dealing with older people, all these groups will be routinely involved. And some of them in roles that are not very commonly considered. For example, speech and language therapists in people with dementia. In dementia, communication problems are are a really big issue, and helping to work out what people can and can't do, and to identify approaches to help communication can help. I think also with multidisciplinary working, you've got multiple points of contacts for families as well, and this is something we've got to get a lot better at. Occupational therapists in particular are very good at negotiating with families, but day by day it's going to be often nursing staff that are responding to family queries, whereas doctors will often be involved in a lot of information gathering and strategic planning, for instance around discharge or future care needs.
All staff who interact with patients, whether clinical or non-clinical, have an important role to play in preventing patients' distress. Josh has learning disabilities and is visiting an outpatient clinic accompanied by his carer. He has regular appointments at the clinic and has not shown any signs of anxiety in that environment. In the past, Josh has also adjusted well to the increased number of people around him.
This afternoon?
Park.
Yeah? Do you want to go? We can walk around by the skate park if you like.
Park.
Yeah, okay. Do you want a drink or some crisps? I'm just going to have to go get some change, okay? I'll just be 2 minutes. I'll go get some money and then I'll get you something to drink, okay? You just stay. I'll be back in a second, okay? Oh, excuse me a second. Hiya, can you just watch Josh a second? I'm just going to get some change.
Yes, that's
all right. Thank you. Thanks.
Although the risk of Josh exhibiting any kind of challenging behaviour was considered low, his doctor and carer frequently discussed his needs and have put together a plan in case he does become anxious or frightened. Before his visit, Josh's doctor made sure the clinic receptionist was aware that Josh would be attending, so she could look out for any signs of discomfort or distress. This prior planning is key to staff understanding the individual needs of patients. Because she was included in prior planning, the receptionist also knows that talking to Josh in a calm and comforting way usually helps to reduce his distress.
Be calm. You'll be all right. Please don't worry. What's the name of your carer again? Josh? Josh? What's the name of your carer?
Gail.
Gail. She won't be long. You'll be all right.
Josh, you all right? I told you I'd just be a minute, Josh. I'm back now. Come on, let's go sit down. I've got some money now. We can get some drinks, okay?
A vital part of preventing challenging behaviour for all staff is to know about the triggers which can cause someone to become distressed, and also about what helps to calm and reduce their anxiety. Specific care planning is needed where there is significant distress or risk of challenging behaviour. Based on learning from today's situation, Josh's new plan will incorporate changes to ensure he does not experience similar anxiety at his next clinic appointment.